Hi there, this is Kieran here from Flex Physiotherapy, and I just wanted to do a short video today on trochanteric bursitis, as it's commonly termed, or lateral hip pain, or gluteal tendinopathy is the other thing it's called. First of all, what is it? Well, a bursa is commonly termed a fluid-filled sac. So you have this sac of fluid, and it tends to sit between two structures in the body. It might be between a bone and a tendon, for example. And a bursa is there typically to reduce friction between those two surfaces. And you've got these bursas all over your body. You have one that sits on the bony prominence on the outside of your hip, and that's commonly termed a trochanteric bursa. Trochanteric bursitis is theoretically an inflammation of that bursa. The problem with the term trochanteric bursitis is that it's a bit misleading, and it's also a bit simplistic. We used to think that this nasty pain that you get on the outside of your hip was simply an inflamed bursa. Hence the itis, which just means inflammation. We now know that that's far too simplistic, and a lot of the time when you've got this pain on the outside of your hip, there's almost always an element of gluteal tendinopathy, which is a fancy way of saying pain in the gluteal tendons. Now, the gluteal muscles are the largest, most powerful muscles in your body. So there's a lot of stress going through the gluteal tendons. And almost always with this condition, the tendons have become sensitive, they've become sore, but most importantly, they've lost their ability to withstand load. Okay, the big load that's going through those tendons, it's lost its ability to cope with that load. So it becomes degenerate and it becomes sore. Okay, now why is that important? Well, it's important because the typical way we would historically treat a trochanteric bursitis is that we rest it, you might ice it, you might inject it. But all of those things are not going to regain a tendon's capacity to withstand load. And in fact, if you rest something, it's just going to adapt to that rest and it's going to get weaker over time. If you inject it with steroid, we know that steroid weakens collagen. Okay? So steroid will actually weaken a tendon, okay? Which is probably not a great idea if actually the goal is to try and regain that tendon's capacity to withstand load. So actually our traditional way of managing this condition probably wasn't the best thing to do. So essentially with these gluteal tendinopathies, we need to try and load them up in a slow, steady, sequential way. We need to slowly increase the load going through that tendon. And what will happen over time is the tendon will adapt to that load and the tendon will get stronger. It will regain that capacity to withstand load and the tenderness will slowly settle down. The problem with that is that it takes a long time, and it may even take 3 or 4 months to regain that loading capacity. The way we often deal with this sort of pain is that we rest it excessively, so the tendon becomes weaker. As the tendon becomes weaker, actually you're more likely to get pain. So you kind of get yourself into this spiral where you rest, the tendon gets weaker, you get more sore, so you rest. And we really need to try and reverse that cycle by slowly increasing your activity levels and increasing the amount of load that goes through that tendon. Now, just a word about load management. Now, sometimes if the pain's not too bad, you can just kind of suck it up and you can load it up and it doesn't respond too badly. And if that's the case, then crack on and just slowly increase your activity levels. Sometimes you get these we call very reactive tendinopathy. So whenever you try and load it up, it just becomes very sore and very inflamed, and it really doesn't respond very well to that load. In that case, you might need to just wind it back and just try and put a little bit of load through and slowly build it up, but start from quite a low base. You may need to give yourself quite a bit of rest after you have loaded it before you load it again. Sometimes, if it's really bad, you may need a steroid injection just to dampen down the process a little bit before you start to load it. But I really wouldn't recommend that unless you really cannot manage. You're far better off just slowly loading the tissues and building from there. Now, in terms of how to load, well, you know, there are specific exercises that can be done, and you can find a physiotherapist that can guide you through that process on a one-to-one basis. But really, there's no magic here. You know, if you slowly increase your activity levels, be that walking, cycling, swimming, whatever it may be, and you listen to your body and you do it in quite a controlled way, over time you'll find that the symptoms will slowly settle down. The other thing to bear in mind is that just because it hurts, it doesn't mean you're harming yourself, and that's quite an important message. Right, so it's about managing the load appropriately. If it hurts for maybe half an hour or an hour after you've exercised, then that's absolutely fine, because it's not going to stop you next time. If it hurts for hours afterwards or days afterwards, then you know, maybe you might have overdone it a little bit. So you might need to reduce what you do a little bit, but still try and get some load through the tendon. So I hope that's been helpful. Bit of a whistle-stop tour. Any questions on this, then feel free to post below, and I'll do my best to try and answer those. And once again, this is Kieran here from Flex Physiotherapy. Hope this has been helpful, and I'll speak to you soon.